Hello, this is Daniel Wolfson from the ABIM Foundation. I'm being joined by Judy Nowicki from the Wisconsin Collaborative for Healthcare Quality, one of our grantees through the Robert Wood Johnson Foundation that's advancing the Choosing Wisely campaign throughout Wisconsin. So to start with, could you talk a little bit about what is WCHQ?
The Wisconsin Collaborative for Healthcare Quality, WCHQ, was formed in 2003. Since that time, WCHQ has been publicly reporting quality data to improve the overall quality and affordability of healthcare in Wisconsin, as well as health of individuals and communities. WCHQ has 40 members consisting of integrated health systems, medical groups, clinics, and hospitals, which collectively represent between 60 and 65% of primary care physicians.
So tell me, how did you get interested in the Choosing Wisely campaign? Why were you attracted to participate in Choosing Wisely?
Well, several reasons, and one was that we had been fortunate to receive funding from Choosing Wisely and the ABIM Corporation Foundation in 2013 for a 2-year project. Efforts at that time were focused on consumer education, including 5 important questions to ask your doctor whenever you visited a physician. At that time, WCHQ partnered with AARP, Consumer Reports, and Choosing Wisely. So during that time, WCHQ had built some very strong collaborative relationships to improve process measures and clinical outcomes with a broad range of stakeholders. And throughout that Choosing Wisely campaign, our members and stakeholders participated in various briefings, learning events, and meetings, which reinforced the concept of appropriate care at the appropriate time. And so WCHQ members were involved in that campaign, and due to the ongoing interest and commitment of our members, it seemed fitting that we be involved and move that to the health system level.
And so describe some of your initiative and how you're approaching this new grant that really looks at reduction of use in 3 areas.
WCHQ proposes to reduce the utilization of tests and treatments as discouraged by Choosing Wisely, influencing patient and clinician attitudes and behaviors. We hope to do that by, first of all, sharing medical evidence and education for providers and best practice guidelines, which they can adapt if they so choose. We also hope to standardize work plans and then create and develop decision support tools, as well as create and implement provider reports that are meaningful to them. And in some cases, one health system has actually put forth compensation incentives for successful work plans. We also hope to raise patient and provider, patient and consumer awareness, and we hope to engage medical students in our blood utilization project. They normally don't have that in their curriculum.
Are some of the things that you're doing around clinical pathways, are they going to be hardwired into EHRs?
Yes, our 2 systems have Epic at this point, and they have been assessing those Epic screens and tools to be, as well as some other imaging software that can assist with the proper reports and the proper alerts for the providers.
So what kind of partnerships do you have within the effort?
Right now, we are partnering with 2 health systems, Froedtert and the Medical College of Wisconsin, as well as Monroe Clinic, who will reduce the following tests and procedures or treatments discouraged by Choosing Wisely. Both health systems are going to reduce antibiotics in adults with bronchitis. Both organizations are going to reduce imaging for nonspecific low back pain. Our Monroe Clinic is going to reduce imaging for uncomplicated headache, and Fredericton, the Medical College of Wisconsin, will also reduce inpatient blood utilization. Both organizations really wanted to improve quality, and both wanted to reduce waste using lean methodologies. And these fit well with the WCHQ performance improvement philosophy. We are also working with the Wisconsin Medical Society and the Wisconsin Academy of Family Physicians to raise awareness with the providers and promote recognition of providers via their websites and their newsletters, as well as promote performance improvement with continuing medical education credits.
So you've got some terrific partnerships with some wonderful organizations. You've got a pretty ambitious interventions planned. What are some of your challenges that you faced in achieving your goals?
There seems to be like two challenges at this point in time. One is time. It seems like there are a lot of healthcare initiatives, and when we learned about this wonderful grant, many organizations already had established their strategic plan, so they had not known that this was part of an opportunity for them, so their strategic plans were completed before we knew about this grant opportunity. And the other kind of barrier that we see is that we're early in our 3-year journey on the grant, but we've already seen some provider turnover as well as management turnover, which has affected the impact of our work plans.
Great. What would be your hope at the end of the grant? What would you hope to achieve?
We hope to achieve the reduction of utilization of tests and treatments discouraged by choosing wisely in our 4 projects. We also hope to educate providers on the professional values of choosing wisely. And we hope to at least host one learning event sharing our outcomes and lessons learned. We also hope to raise consumer awareness, and one organization is going to be looking at grocery store festivals and utilizing their hospital leadership to talk with businesses. So those are just a couple of examples. And then we also hope to review our WCHQ measurement portfolio. Right now we have over 40 measures. However, none of them are choosing wisely measures. So we really hope to expand and look at what adds value to our protocol. And we hope to raise the value and improve quality and lower cost. So to us, this is a giant step to transform care, as more care is not necessarily better care.
That's great. Thank you so much, Judy. It sounds really exciting, and we're excited to be working with you again as we did the first 2 years and now 3 years, and we look forward to a long-term relationship with your collaborative. So this is our end of the interview. Thank you so much, Judy. If you want to see this interview and other interviews, go to www.choosingwisely.org, and you will see interviews like this and others from other grantees, and you'll get the resources from Choosing Wisely, including some excellent communication modules that instruct physicians how to talk about choosing wisely recommendations and doing less.